Hello, I'm Urologist Erdem Akkaya. Friends, today's topic will be about how to activate the testicles faster after testosterone or anabolic use and how to provide testicular rehabilitation faster, in short, PCT. I get a lot of questions about this topic. For example, let me read the last question. I used both Sustanon and Primobolan for 24 weeks, do I need post-cycle therapy? Friends, I actually made many videos that can answer this question. I would like to talk about an important study supported by the World Health Organization. Weightlifters are given testosterone-enhanced therapy, 200 mg per week for 12 weeks. They follow the testosterone levels of these weightlifters after these 12 weeks. And they see that, it takes only 4 months for the testosterone level to return to what it was before they started using testosterone. Someone will surely say, well, my friend used it, he quit. After 1 month we checked his blood levels and his FSH, LH, testosterone levels were normal. Friends, it can happen. Based on the person's genetic structure, age, duration and amount of medication used, this situation may vary. We have the following problem: after stopping these drugs, depending on the drug used, the person's testosterone may not recover for a period of 6 months to 1 year. And people can have a lot of trouble here. For example, let me talk about the last patient I saw, who is a trainer. He used propionate master and trembolone. He came to me with erectile dysfunction after 6 months. When we checked his testosterone level, we see that it was 1.75. Friends, this was also the best testosterone level of the last 6 months. What will happen when he comes with the best testosterone level of 1.75? There will definitely be sexual problems because it is very low. Not only is it low, but before that he had very high testosterone levels. So it went from very high to very low. This is a big problem, of course. So what should be done? There is only one drug in Turkey, clomiphene citrate. In the US, there is another drug called enclomiphene, which is said to be more sensitive. But there is only one drug in Turkey, it has only one dose and form. And this drug is the only drug that enables the secretion of LH and FSH from the pituitary, and there is no other equivalent. When you use it once a day, LH and FSH levels are regulated in most patients at the end of the first month. How can the person be supported faster during this time? Pregnyl is no longer on the market to provide even more support during this period, so Ovitrel can be used instead. There is also a myth here, friends. If you take 5,000 units of it, they say your Leydig cells die. Friends, there is no such thing. In some patients we call hypogonadotropic hypogonadism, LH and FSH secretion is congenitally absent. In these patients, we apply Ovitrel and Indocin 4 times a month, once a week. And the Leydig cells of these patients are not destroyed or damaged. Thanks to these drugs, people can impregnate their partner and have a child. There is a situation like this. Again, among anabolic drug users, there are people who use Pregnyl and HCG for decades. If you use it for a very long time, you may develop insensitivity in the Leydig cells. Other than that, there is no risk in a few months of use. Of course there is a risk as a medicine, but there is no risk of killing Leydig cells. This is a complete urban legend. Other than that, to summarize, we use clomiphene and if necessary Ovitrel in PCT, testicular rehabilitation. If you wonder if you need it, just have your FSH-LH, estrogen, testosterone levels checked in the first month. Finally, I would like to say that this video is definitely not a treatment recommendation. It is a video made for informational and information sharing purposes. Thank you for listening, best regards.